Hey, Nurse Terry here again, and it's time for another Test Tip Tuesday. So today we're going to be zoning in on the difference between first and best in test questions. I mean, honestly, did you ever think about the difference? I have to say, even being a professor for so long and writing so many test questions, I'm not sure I ever sat back and thought, what is the difference between those two words? So today we're going to clear up any confusion so you know what to do on the next exam. All right, so first means you have to do this immediately. So think ABC priority type of things. For example, if somebody punctured an artery, you got to hold pressure on that baby fast or you're going to end up, somebody's going to bleed to death. We don't want that to happen, right? So that would be something that you would do first, right now. On the other hand, best means what would you do in an ideal situation? What would be most important if all the stars lined up and there was no problems with anything? So best case scenario, we would sit down in a calm environment and educate someone. But that is certainly different than something you would do first. So are you seeing there's quite a difference between first and best? So stay tuned for a little bit more. Now let's review one example so that you are absolutely sure to take away this information. So let's take, for example, someone has an O2 sat that's around 88. Well, your first priority is to get that oxygen level up. Some nasal cannula, some repositioning, whatever it is, ABCs, airway and breathing, are going to be at the top of that list. On the other hand, if someone asked in a test question, what is the best way to provide education on hypertension, you might sit down and talk about sodium content in foods. Certainly, the best way to deal with that is different than something that has to be first. So here is a great way to remember this tip. First keeps your patient alive, and best helps them thrive. Just like you've got this, and take that information to your next exam.